Hello everyone, I'm urologist Omar Erdamakaya. Today we will answer one of the most frequently asked questions. What is it? Will I become addicted if I take medications containing the active ingredient Cialis, Viagra, such as tadalafil and sildenafil? Friends, if the doctor prescribes these drugs, you probably have a complaint. So why do we give these medications? We give these medications to treat the inability to get or maintain an erection during sexual intercourse, which is erectile dysfunction. In other words, the person is taking these medications because they need them, they are not taking them randomly. I have given a video before about arbitrary taking. In that video, we mentioned that arbitrary taking can lead to psychological dependence. But if the patient uses them for treatment, that is different from addiction. If the person is taking these medications and not making an effort to manage both lifestyle and the cause of their erectile dysfunction, these medications naturally overshadow the problem, and the main cause continues to grow. For example, the person has diabetes, has uncontrolled diabetes, benefits from taking these medications, but the uncontrolled diabetes continues to increase. The problem gets bigger and bigger, and finally after a while, these medications do not work anymore. Or the patient's testosterone level is low, and he has no treatment for it. After a while, when the problem gets bigger and bigger, he falls into it, even though he is taking medication. For example, the patient is overweight and takes these medications. He has erectile dysfunction due to his weight and hormonal imbalance, but in the meantime he loses weight and changes his lifestyle. What is the next? The person who has changed his lifestyle, lost weight and regained his hormonal balance, can now get an erection even if he stops taking these medications. These drugs, friends, because they are also psychologically good for the person. And if the patient has a psychological erectile dysfunction, he can get better by taking these drugs. But some time ago there were some publications where we gave Cialis, namely Tadalafil, for treatment, so you could take it once a day for 3 months. It has been said that this fixes the endothelial and vascular structure of this region. However, recent publications have shown that this is not the case. Continuous use of Cialis or Viagra has no therapeutic effect on endothelial structure. It has no therapeutic effect on erectile dysfunction. It just makes the person feel comfortable when taken. There are also different dosages. For example, there are 25 mg of tadalafil, 5 mg of Cialis, 5 mg, or 20 mg of Lifta. At the same time, there are patients who use Viagra by splitting it. There is a tablet of 100 mg Viagra or Degra which contains sildenafil. People can use it as 25 mg, 50 mg, or 100 mg. Of course all of these must be under the control of a doctor. The person carries out their treatment under the control of their doctor, using the lowest dose to which they get a response. As I said, these medications are not addictive, they do not make you worse than before. You should not think that way about them. We already give them to the patient because they need them. Thank you very much for listening, with kind regards.